Hi, I'm Patricia. I chose to have a knee replacement because I had gotten to a point in my life when I could not do all the things that I wanted to do. And I had always heard that when it gets to that point where little things like getting dressed or not being able to ride my bike or something was an issue. Literally, even just getting dressed, I would have difficulty to put my shoes on. Not that I couldn't put them on, but I just couldn't put them on as easily as I could in the past. I consider myself an athlete. I used to run a lot and can no longer run. I then started biking a lot, and even biking had become a problem for me. The biggest problems that I had with my gait were that when I would initially get up from a sitting position, I would have difficulty just starting off and walking. If I was getting out of a car, especially if I had sat there for any period of time, even just 20-30 minutes, it would be very painful when I got out of the car. If I was in a long distance trip, it was truly painful. I would have to hold on to my husband's arm to start walking. Once I started walking, I was pretty much okay. At work, sitting behind a desk, or sitting in a chair and getting up and moving, I would have difficulty getting that walk started. So that was probably my biggest gait problem. I am very glad that I've chosen to have the knee surgery, and I am especially glad that I chose to have it with Dr. Berger because he provided the minimally invasive surgery, which allowed me to go home the same day. It allowed me to not have general anesthesia, and it allowed me to get back into my normal routine a lot more quicker than it would have had I done it in the traditional manner.
A few hours after surgery, Patricia is ready for physical therapy. Physical therapy is important for safety, comfort, and confidence. Within a few minutes, you will be walking by yourself, and if you want, without a cane.
Getting up myself after my knee surgery and moving just goes hand in hand with the rest of it. It's the quicker you get moving, the better it's going to be. I was very impressed with the fact that that was required. Anybody that I talked to who I said, I'm going home the same day of my surgery and I'm having physical therapy the next day, were surprised about that. But the quicker you get moving, the better it's going to be.
You will be walking immediately after surgery. It may be easier to use a cane at first. Within minutes of getting up and walking, you will be off the cane and walking unassisted if you feel comfortable. Your physical therapist will show you how to use a cane. The cane helps provide a little extra support while you are walking. Your cane goes on the opposite side of your surgical leg. When you walk, your cane and surgical leg work together. As you walk with the therapist, you will speed up your walking, and the cane and surgical leg will move together. This will facilitate a normal walking pattern. You are allowed to walk without a cane as soon as you feel ready. After surgery, your knee is strong and stable. The pain you had in your knee before surgery is gone. This allows you to walk without the cane once you feel ready. Your physical therapist will help progress you off of the cane.
Walking and doing stairs right after surgery was somewhat challenging and somewhat daunting, but once I started doing it, going up the stairs, it wasn't as bad as I was afraid it was.
After you walk down the hall, you will go up and down a flight of stairs. To begin, the physical therapist will have you use the cane. Within minutes, you will be doing the stairs on your own once you feel safe and comfortable. In Patricia's case, she felt more comfortable using the cane. As you face the stairs, place your cane on the opposite side of the railing. Bring the cane up onto the step in front of you. Step up with your non-surgical leg first. Your surgical leg will follow as you step up onto the step. Continue this pattern until you reach the top of the stairs. Place the cane on the opposite side of the railing. Move the cane forward, placing it on the step below. Next, step down with the surgical leg. Your non-surgical leg will follow as you step down. Continue this pattern until you reach the bottom of the stairs.
When I left the hospital, getting into the car initially, the most important thing probably is to be secure and to be safe, to walk with whatever device it is that you're using. I had a cane, so I got out of a wheelchair, had the cane.
When you are ready to leave the hospital after surgery, we will get you a wheelchair. The following demonstration will teach you the easiest way to get in and out of the car after surgery. To begin, have someone move the seat of the car all the way back. Next, recline the backrest of the seat to allow more space. Back up into the car. Extend your surgical leg out as you sit down, with your bottom first onto the seat. Try to bring your legs into the car together as a unit. Rotate your body with your legs together as a unit. Bring both legs outside the car, staying seated. Extend your surgical leg forward as you push up to stand from the seat of the car. You may place your hands on the seat or the dashboard of the car to support yourself while standing. Place your cane in your hand opposite your surgical leg.
Getting into the shower initially after surgery required care. It's important to not just try to jump into the shower like one might normally do. My shower happens to be in the bathtub, so I had to climb over the bathtub to get into my shower. And figuring out which leg I was going to put in there first was something to consider.
When you are at home, it may be difficult to get in and out of the shower or bathtub. The following demonstration shows you how to do this safely and independently. Stand facing the front or back end of the shower. It doesn't matter which leg you step in with first. If you don't have grab bars, brace yourself with your hands on the wall. Bend your knee behind you as you step into the tub. Sidestep toward the inside. Stay holding onto the wall as you step in with your other leg. Stand facing the front or back end of the tub. It doesn't matter which leg you step out with first. Brace yourself with your hands on the wall. Sidestep toward the outside of the tub. Bend your knee behind you as you step out. Stay holding onto the wall as you step out of the tub with your other leg.
The importance of doing exercises, physical therapy exercises after surgery, I think is probably one of the most important things that a person can do. And I'm sure that there are some people who are 100% or 200% at doing their exercises, which is wonderful. Many people procrastinate and say, well, I'm going to do that tomorrow, I'm not going to do this many exercises now. And the problem with that is that the more you do, well, you don't want to do too much. You don't want to be doing your exercises 10 times a day. But once or twice a day is really essential, because if you don't do it, then you're not going to recuperate as fast. Physical therapy exercises, and they are important. I think if you don't do them, the longer you don't do them, the less you're going to get. You're not going to get your range of motion back. And if you go too long without doing that, then it's a done deal and you'll never get it back.
After you leave the hospital, your home physical therapist will give you an exercise program. Exercise is important after surgery to help improve your range of motion and strength. Make sure that you start out slow, especially in the first week after surgery. The following exercises will help you get started. Lie on your back, keeping your surgical leg straight. You may bend the non-surgical leg if this is more comfortable, but it is not necessary. With your surgical leg, slowly tighten the muscle on the top of your thigh by pushing the back of your knee into the bed. Hold for 5 seconds and relax. Repeat this motion 10 times. Lie on your back with both legs straight. Slowly move your surgical leg out to the side and return. Make sure you keep your legs straight and your toes pointing toward the ceiling while moving the leg out to the side. Repeat this motion 10 times. Lying on your back, bend your non-surgical leg. Keep your surgical leg straight and tighten the muscles on the top of the thigh. Then, lift your leg until it reaches the height of the bent leg. Return to the start position and repeat 10 times. With your surgical leg over a roll or pillow, straighten the leg by tightening the muscle on the top of the thigh. Keep the bottom of your knee on the roll or pillow throughout this motion. Once your surgical leg is straight, hold for 5 seconds. Then, slowly lower your leg back down. Repeat this motion 10 times. Sit in a chair. Keep both feet on the floor. Slide the foot of the surgical leg back, bending your knee. You may place a washcloth under the foot of your surgical leg to help slide the foot back. Once your knee is bent, hold for 5 seconds. Then straighten the knee. Repeat this motion 10 times. Sit in a chair with your feet flat. Straighten your surgical leg and hold for 5 seconds. Return to the start position and repeat 10 times. Stand facing a table to support yourself. Bend the knee of your surgical leg as far as you can. Return to the start position. Repeat this motion 10 times.